Hello, Jane. My name is Melissa, and I will be your healthcare provider here in the clinic today. I believe you are here to discuss your lab results from last week. One of the labs we did is called a hemoglobin A1C. From that lab, we can tell what your average blood sugar has been over the past 3 months. It shows that your blood sugar has been at a level much higher than normal. Another lab that we did on your blood shows that your blood sugar when you haven't eaten all night is also running high. When we were talking about your symptoms last week, we mentioned that you may have diabetes. This lab work shows that you have diabetes. Diabetes is a serious disease where the high blood sugar causes things to work wrong in your body. You have an organ in your stomach that helps you digest food. This organ is the pancreas. The pancreas also makes insulin. Sometimes it doesn't make enough insulin. Insulin is a hormone that helps all the cells in your body use the food that you eat for fuel. Sometimes the cells in your body don't recognize the insulin anymore. The insulin is like a key to the cells in your body to let the blood sugar into the cells. The cells won't let the glucose in your blood into the cells without the insulin. The insulin is like a key, but it's not opening the door. When you can't use the glucose in your blood, the blood glucose level gets high and you have diabetes. When you have high blood sugar in your blood, it can damage many parts of your body. It can cause you to not heal when you have cuts. It can also make you more likely to get infections and get sick. It causes your immune system to not work well. It can damage your nerves so that you don't feel it when you get injured. In the long term, high blood sugar can damage your heart, kidneys, and other organs. It can cause you to be sick and die younger. That's why we need you to try to get your blood sugar under control. Part of that plan will be you trying to lose weight. Your blood sugar will not run as high if you weigh less and have less fat in your body. Exercising will help you lower your blood sugar level. I'm going to also order a new medication for you that is going to help you get your blood sugar down. The medication is called metformin, and it has a brand name called glucophage. You may have heard it referred by either name. Even children with diabetes can take it if they are aged 10 or older. They would take a similar dosage to what I'm going to start you on. Metformin is a pill that you're going to start taking once a day initially. We will probably increase the dose in the future. We first have to see how your blood sugars respond to it. Metformin works in many ways to help you lower your blood sugar levels. From your stomach, it will go into your intestines where the medication will be absorbed into your bloodstream so that it can travel around in your body. When the metformin is in your bloodstream, it will go through your liver. Your liver is an organ in your body that helps you digest food. It also filters chemicals out of the blood. The metformin will help your liver, in this case, to make less glucose from the food that you eat so that the blood sugar level in your blood is lower. The metformin will also make it so that you don't absorb as much sugar from the foods that you eat. The metformin will also help the cells in your body recognize the insulin as a key to allowing the glucose into the cells. That will also make your blood sugar lower. Eventually, your body will get rid of the metformin by urinating it out. Elderly people who have more problems with their body, like their kidneys and livers, may have to take a lower dose of metformin. Sometimes they may not be able to take it at all. If they have liver problems, it can hurt the liver. If they have kidney problems, they may not be able to urinate the medication out of their body well enough, and they might end up having high levels of it in their blood. You will also need to start eating a better diet. A healthier diet will help you lower those blood sugar levels as well. If you start the metformin and continue to eat a diet that is unhealthy and high in sugar and carbohydrates, like sugar, cookies, chips, and ice cream, the metformin has a side effect that you may not like. It can make you very gassy, crampy, and possibly sick to your stomach. You may develop diarrhea because it is going to make you have bowel movements more frequently. Eating a healthier diet without the junk food will make you tolerate taking the metformin better. It will make your blood sugar levels get better quicker. By starting to exercise, even walking 30 minutes a day will help your blood sugar levels get lower as well. The exercise will help the cells in your body use the insulin in your body better. A nice side effect of metformin is that in combination with a better diet and exercise, it will help you lose weight. Being overweight also increases your blood sugar and makes your diabetes harder to control. Because of those possible stomach problems I mentioned previously, some side effects of metformin can also make you start having low blood sugar if you end up taking additional diabetes medications. Metformin can also decrease your appetite and you may develop a rash. It can make you have a metallic taste in your mouth, and it also may start you to ovulate if you have problems with not having your period. It will make your ability to get pregnant become higher, and you may need to use some sort of birth control. You shouldn't drink alcohol when you're taking metformin because it can affect how well your liver works. You can also develop something called lactic acidosis when you take metformin. Lactic acidosis is when your body chemistry gets thrown off by already being sick with an infection or having other health problems, like with your own kidneys or liver. Lactic acidosis can make you extremely sick and potentially kill you. So if you develop abnormal nausea, abdominal pain, trouble breathing, get confused, have a low blood pressure or a fast heart rate, you may want to go to your doctor or go to the emergency room. Jane, do you have any questions for me? That was a lot of information to take in at once.